Medicare drug costs are going down, and IRS penalties for HSA contributions may be going away for Medicare recipients. Hello, and welcome to our latest Medicare update. First up, let's talk about health savings accounts, or HSAs, and how they interact with Medicare. It's common for individuals to remain on their employer's group health plan or that of their spouses when they turn 65, and simultaneously enroll in Medicare Part A only, since it has no monthly premium. The issue, under current IRS rules, if you're enrolled in any part of Medicare, including Part A, you're disqualified from contributing to an HSA. This has unfortunately led to a number of individuals continuing to contribute to their HSA, often unknowingly, while also receiving tax benefits, only to discover later that they were ineligible. This can result in potential IRS penalties, which is certainly something we all want to avoid. Here's the good news. There's a proposed piece of legislation, sometimes referred to as the Big Beautiful Bill, that's currently working its way through Congress. This bill includes language specifically designed to remove this restriction, allowing working seniors who are enrolled in Medicare Part A only to continue contributing to their HSA accounts without penalty. This would be a huge relief for many of our customers, and perhaps you as well. Now, it's crucial to remember that this bill has not yet passed both houses of Congress and has not yet been signed into law. While the proposed changes are very promising, they are not yet official. We will certainly keep you updated on this legislation as it progresses. Let's shift gears and talk about Medicare Part D, your prescription drug coverage. Medicare Part D has seen some fundamental and substantial changes, particularly in recent years, and it's evolving even more. It's a far cry from what it was when it was first introduced in 2006, and even significantly different than it was just 3 years ago. Several key enhancements have taken place, making prescription drugs for Medicare recipients more affordable and predictable. For example, the infamous donut hole, or coverage gap, has been eliminated. This means you no longer have to face that phase of coverage where you are responsible for a higher percentage of your drug costs. Additionally, copays in the catastrophic coverage phase have been completely eliminated. And perhaps most importantly, an annual maximum out-of-pocket limit has been implemented for covered medications. This year, in 2025, that maximum out-of-pocket limit is $2,000. Once your year-to-date out-of-pocket costs for covered medications reaches this amount, your plan will cover 100% of the costs for the remainder of the calendar year. For 2026, this limit will be adjusted for inflation, increasing slightly to $2,100. But perhaps the most significant changes, and where you'll really feel the impact, will come into play as we roll into 2026. That's when the first 10 medications that were negotiated for lower retail prices under the IRA legislation passed several years ago will take effect. Let's look at an example. For a medication like Eliquis or Jardiance, both commonly used, let's say you take Eliquis and the typical monthly cost is around $500. Today, in 2025, if your plan has a deductible, you'd pay the full cost for your Eliquis until you meet that deductible. After your deductible and in your initial coverage phase, you might have a copay or coinsurance, perhaps 25% of the retail price, meaning your monthly cost could still be around $125 per month. You'd continue to pay this amount in copays along with the prescription costs until your total out-of-pocket spending for the year reaches $2,000. Once you hit that cap, you pay nothing for the rest of the year. Now let's fast forward to 2026. With the negotiated lower retail price for Eliquis, the new list price is significantly reduced, around $225 a month. While your specific copay or coinsurance will still depend on your plan, the overall cost your plan is based on will be much lower. This means it will take much longer for you to reach your deductible, and more importantly, your out-of-pocket maximum. Your copay, after your deductible is met, might only be $50 or $60 per month. Therefore, your total cost for Eliquis for the year would be substantially less than it was in 2025. These changes to Medicare Part D are designed to truly make your prescription drug costs more manageable and predictable. We're making available to you some new tools on our website to help you manage your plan enrollments and check your annual cost estimates. We'll be showing you these tools in upcoming videos. Thank you for joining us today. We'll continue to keep you informed about these important developments in Medicare and how they can benefit you. Stay healthy, be well, and we'll see you next time.